Welcome back and welcome to the Daily Brief on Metro Milwaukee's health and the economy. My name is Tim Sheehy. I'm president of the MMAC and joined by my co-host again today, Dr. John Raymond, president of the Medical College of Wisconsin. Each day at 3:30, we deliver a 19-minute fact-filled update on the health and economic impact of COVID-19. The webcast is powered by Aurora WDC. And today we have our special guest, also from the Medical College, Dr. David Cipriano, who will give us an update on managing mental health during the pandemic. So as we do, let's begin our briefing with a healthcare update from Dr. Raymond.
Thanks, Tim, and good afternoon to everybody. Before I start with the daily report, I do want to make sure everyone understands that we always caveat Monday's numbers because of potential reporting lags over the weekend. As of today, there were 41 new COVID-19 positive tests in Milwaukee and 153 in Wisconsin. The average daily growth rates, which are calculated using all of the data since March 12th, continue to improve to 6.1% in Milwaukee and 6.7% in Wisconsin. Now, we've included a new metric today, which measures the average daily growth rate over the last 7 days, which could give us additional insights into our current state. The 7-day average growth rate was 3.3% in Milwaukee and 4% in Wisconsin. And recall that a month ago when we started measuring these, the growth rate was nearly 35%. So this demonstrates that we've made progress in slowing the spread of COVID-19. The doubling rates were originally lower than every 3 days when we started to measure them 3 weeks ago. So today, our doubling times continue to improve to 11.5 days in Milwaukee and 10.4 days in Wisconsin. So again, we continue to make progress. Now later in the week, I'll show you some intriguing evidence that Milwaukee might actually be doing better than other parts of the state in terms of stemming the growth of COVID-19. Next slide, please. This slide shows key indicators of hospital capacity. The capacities are similar to those we showed last week. The first 3 rows show that we have ample capacity of hospital beds, ICU beds, and ventilators in our region. But we still have a significant number of hospitals with an insufficient supply of personal protective equipment, as shown on the last row. And as I've said before, I believe this is going to be a problem for us for quite a while, even with the responsible reuse of N95 masks and switching from disposable to washable gowns. But I'm encouraged that PPE was identified as a core responsibility in the Badger Bounce Back program, which was announced just 2 hours ago. Next slide, please. In the interest of time, we'll skip our health and safety indicator stoplight chart for today, and we are going to reevaluate that in the context of the Badger Bounce Back program. I've highlighted the key components of the Bounce Back program on this slide, and we'll be able to ask more detailed questions tomorrow when Governor Evers joins us at 11:30. The Badger Bounce Back program has 3 phases of reopening that are similar to the phases outlined in President Trump's guidelines for opening up America plan. The plan provides for flexible implementation and interim progress within the phases, which we appreciate. It also outlines 5 core responsibilities, including testing, tracing, and tracking of COVID-19, and ensuring adequate quantities of PPE and a sufficient healthcare capacity. There are 3 gating criteria for the phased reopening, and these focus on symptoms, cases, and hospitals. And many of you who've been listening know that these principles overlap with the plan that the MMAC approved last Friday and shared with Governor Evers. So obviously a lot to discuss and digest. And I want to thank Tim for his leadership and turn it back over to Tim now.
Thank you, Dr. Raymond. And before we bring Dr. Cipriano in here, kind of an interesting tidbit, at least I picked up from your opening remarks, and it sounds like we're going to have data later in the week. While Milwaukee, at least the city, had roughly 40% of the cases across the state, you're saying, wait a second, though, even though that's an important factor, focus on the rate of growth. And you seem to be saying that our rate of growth may be slowing more so than outstate.
Yeah, I think so. It'll be fun to talk about. It'll be more than just the doubling times, but we're going to show you the doubling times tracking since March 12th to today. And there's actually a crossover where when we started, Wisconsin was doing better, and where we are today, we're a little bit ahead. And there's some other evidence that we're bending the curve down pretty well here.
I know you probably can't join us by video, but Dr. Cipriano, you're there by phone?
Yes, I am.
Great, good to have you here. As Dr. Raymond and I can attest to, stress and mental health are important as we go through this crisis. So we're very pleased to have you with us today to talk a little bit about how people can manage this in what is clearly uncharted territory.
Yes, glad to be here. Thanks for having me, Tim. You know, that first slide there represents something that Sam Gill recently came out with. He's the Chief Program Officer at the John S. and James L. Knight Foundation. And he talked about three things that leaders can do right now. And the first, as you see on that slide, is to accommodate those who need to take care of themselves and their families right now. People do have a lot of stress that they're going into, and the degree to which the workplace can be a support for them at those times, we are going to be preserving those workers for days to come. The second one is give people permission to drop former priorities just so that they can focus on the task at hand here. That is all of the many issues that have come up during this crisis. You know, our employees are very focused. They want to do their best, and they're still thinking back to that whole list of things they had to do before this crisis hit. Some of them need permission to say, hey, no, we've got a new focus here. Again, as Dr. Raymond said, this is uncharted territory. We really need to let you go ahead and focus on this right now. The third thing is, for those that wish to, let them look ahead to what sorts of innovations might come out of this, right? This is the silver lining to all of this. We are finding out, I think, that, you know, we may not, there's going to be a new normal we go back to, right? And so what are those changes going to be? And many of them will be changes for the better. So we've got people really looking forward to what, you know, new service delivery models maybe might we discover, and how can we, if you go to that next slide there, we're talking about how do we study those? How do we study what's working and so forth? I know at the medical college right now in my department, the Department of Psychiatry, we've shifted entirely to telehealth. That is telephone sessions and therapy and diagnostic sessions using video conferencing platforms. So all across, not only in our department, but all across MCW, we've got people studying these things already. We're studying our providers. How do they feel about providing services in this mode? Do they feel confident doing it? And even more importantly, studying our patients' reactions to these new service delivery modes. Because again, on the other end, who knows what it's going to look like? And we would find ourselves ahead of the curve if we've studied how people feel about these new innovations and be ready for this sort of post-COVID world that we're heading to. If we go to the next slide, then this is a busy slide with, I think, lots of things that leaders can do in their organizations. First of all is keep future focused and direct people's attention to the positive effects that they've already begun to see. What is it going to have on, what effect will it have on future operations, right? To the ability for our employees to see how we're going to evolve gives people a lot of hope. And secondly, there's a lot of anguish over how much we have yet to do to adapt to this, and people are worrying all over the place about how we are adapting. I think it's useful, and I've seen it done in my department and across MCW. Our leaders really helping us all take stock of, wow, look at what we've accomplished already in these last 3 or 4 weeks. And it really does give people a much more positive outlook to be able to take stock of how far we've come. It's great for us to give that personal touch to our employees, to reach out to them, recognize who's making special efforts, whether it's just, bringing in homemade masks and other PPE, to, reaching out in little ways to support coworkers and so forth. It really builds that sense of community and camaraderie in our organizations. And next, we don't want, everybody's expending the maximum amount of energy to just cope, right? And these are major changes in our work lives and in our personal lives. And if we're expending energy on trying to find out who's to blame or where we should direct our anger and resentment, that's wasted energy. So do what we can to get the folks in our organizations off of this issue of where to focus your anger, even to stay angry. Let's just get people focused on where we're headed and how far we've come. Toward that end, we can do a lot of things to boost people's mood in more positive ways. Starting a company gratitude board is a great start. We've been doing this at MCW for the last couple of years. It's one of the most popular things we've got going. And we literally just set up a whiteboard outside of one of our major classrooms. And there are just over the 2 years now, there's been thousands of entries, and we're cataloging all of those. It can be a virtual or a digital gratitude board as well. And along those lines, a digital journal. Journaling, especially during times of stress, has been shown to have a big impact on mental health. And that impact is potentiated when you'll share what you're journaling with other people. So to make it public and let other people bounce off of each other and what their what their insights were, can really, again, build that sense of community that we need in our organizations right now to help us get through these stressful times. Next, really nice for leaders to check in with their employees. It's a personal touch, and this is checking in on their home life too, right? Asking how things are going. That goes such a long way. I've been hearing from people that they feel, a little like out of the loop. It's not that their leadership is trying to leave them out of the loop, but I mean, things are moving so fast and there's so many unknowns, there's so much out of our control, that I've just been hearing from people that they feel a little left behind. And so again, to have a leadership reach out personally means a ton. And lastly, people are also craving, besides those emotional touches, practical, pragmatic information about how the organization is doing, how the organization is meeting the challenge of this COVID-19 crisis. And so weekly town hall meetings are a great vehicle to do that with. People tend to really appreciate those. President Raymond's been doing at least one a week, I believe, Dr. Raymond, aren't you? And they're very well received.
Thanks, David. Yes, we have been.
Yeah,
So
thank you. Go ahead. Yeah, thank you very much. I think that's a very helpful update and a lot of good, useful information in there in terms of how people can actually actualize the recommendations that you're making. So, Chris, let's go to questions.
Yeah, absolutely. It's sort of in the spirit of looking forward to good things that might lie ahead in the future, or maybe farther in the future. What is the outlook for large gatherings to resume? Does a vaccine have to be in place for that, or are there other ways to do that?
I think probably we're going to have a vaccine before we have large gatherings, but we still don't know how many people have been exposed to COVID-19. Having antibody testing on populations will give us a better insight into whether there might be the possibility of having herd immunity before we have the vaccine. But I think right now, probably the prospects of going to a football game or seeing a Brewers game are going to be limited until we have that vaccine.
Yeah, and the other thing I would add to that, in the governor's Badger Bounce Back program, there are 3 phases coming out of Safer at Home. And I think the first phase acknowledges gatherings of 10 or under. The second one acknowledges gatherings of less than 50. And then the third phase opens them up. But I think opening them up is the caveat that Dr. Raymond laid out in terms of, large gatherings.
Yes, and we did have a question related to that. How, if you look at the White House's plan, how close are we to entering phase 1, do you think? And what's keeping us away from that right now?
I think having 2 weeks of consistent downward trend of hospitalizations and other metrics that we could say, yes, we're truly having an impact and reducing the number of cases of COVID-19, even though we've done a great job here in Milwaukee of flattening the curve. We're still having somewhere between 100 and 150 and 200 new cases in Wisconsin per day. So we may either be at a plateau or slightly improving, but we really need to be convinced that we're having a significant improvement.
And then the thing I'd add to that, Chris, is in the discussion we look forward to having with the governor tomorrow is the Badger Bounce Back plan, in a sense, a key that has to be completely turned in the door to unlock it before you start to open it? Or is there some flexibility in that plan as we see improvements in different criteria that are listed there? And will that allow us to open up beyond the May 26th date that's currently on the table for Safer at Home?
With some other questions about whether we'd know by now whether there were an effect of the in-person election or religious celebrations, and also some related questions about concerns over the protests we saw over the weekend.
Yeah, good question. We haven't seen an obvious spike, so that's good. We were on a downward trend in a good direction in terms of cases, and that seemed to flatten out. I think it's going to be almost impossible to ascribe cause and effect to that. I am still a little bit concerned about relaxed social distancing from the holidays last weekend, but we'll know more tomorrow and the next day. And sure, whenever people congregate closely like they did during the protests, you really wonder if any of the folks there had an infection that they weren't symptomatic for and maybe passed it on. Again, we'll know in another week or so.
Yeah, and I think outside of the serious medical issues that Dr. Raymond has laid out, with people coming in close proximity to communicate whatever they have the right to communicate publicly, I think part of the challenge going forward now is balancing the economics, the health and safety, and the societal impacts. And all of those are coming into the decision-making process that our policymakers have in front of them.
Great, thank you. And thanks to everybody who asked a question today.
Great, thank you very much, Dr. Raymond, Dr. Cipriano. Thank you very much for your thoughtful assessment of what we can do to help ourselves individually and as an organization get through this. We'll see you again tomorrow at 3:30 and again tomorrow at 11 o'clock. We'll have a healthcare update from Dr. Raymond. We're going to talk a little bit about MMAC's Smart Restart Plan. And then the governor's been gracious to join us at 11:30. So we'll have time to hear from him and have him answer some questions also. So be safe and have a good rest of your Monday.
Thanks, Tim.
Thank you.